My name is Sean D'Andrea. I'm the co-founder of the Native American Emergency Medicine Consortium, and I serve as the Chief Clinical Consultant for Emergency Medicine for the Indian Health Service. We are so happy to have everybody join us here today. We tried to pick a time that was going to work for everyone from Alaska, where we have several colleagues joining, to the East Coast, where we have several partners in leading this year's conference. So thanks everyone for taking time out of your very busy schedules to join us. I'm joined emceeing this event with my colleague and fellow co-founder of the Native American Emergency Medicine Consortium, Dr. Ken Bernard, who is heroically joining us after a night shift. Ken, I think you might be in a loud room. If you are and can't unmute, that's fine. But if you're on your own, just want to say good morning. I think Ken may be surrounded by a huddle of clinicians as he's involved in shift turnover at this point. But thanks again, everyone, for taking time out of your schedules to join us. Thanks to our co-leaders for the conference and all of our presenters who've taken time out of their schedules to join us. The conference, of course, is going to be today, tomorrow, all times Pacific, and that's going to be 8 a.m. Pacific time to noon Pacific time for the next 2 days. We wanted to start this year's, this third conference with a dedication. It's been an unimaginably difficult year for people around the globe. In particular, rural and indigenous communities in this country have, of course, experienced disparate and incalculable suffering due to the COVID-19 pandemic. So this year's conference is dedicated to all the healthcare professionals who have and continue to serve indigenous and rural communities in this country and around the globe, and to all the individuals and communities impacted by the COVID-19 pandemic. And we want to start the conference this year by inviting everyone to join us in a few moments of quiet reflection before we get started. Thank you all, and thank you for all the work that you have been doing in the past year, and we hope that you are all and your families and communities are doing well. Thank you for taking that moment with us. To start, I want to send a thank you at the beginning, and we look forward to introducing several of our colleagues who have joined in the past several months working to coordinate this conference. Want to thank everyone involved in the Native American Emergency Medicine Consortium, our fearless partners at the Frontline Indigenous Partnership, who are in the background running today's and tomorrow's conference, and they're the ones keeping this going smoothly. So we thank them for their work in the past and today moving forward. To Sohotso Medical Center in Fort Defiance, Arizona, which has provided support by contributing for the website, as well as providing the time for providers to work on this conference. To Brigham and Women's Hospital, several of whom their faculty are joining us today, as well as from the Harvard Humanitarian Initiative, and all of our friends and colleagues from the Native American and rural emergency medicine community that have joined us in past conferences. We see several familiar names. We're very excited to see friends from the past and making new friends today. So thank you all for taking time out of your schedule to join us for another Native American and Rural Emergency Medicine Conference. For those who are joining us for the first time, wanted to talk quickly about the Native American Emergency Medicine Consortium, which has a guiding principle that it's a group of folks who are dedicated to improving emergency care delivered to indigenous and rural communities through education, advocacy, and collaboration. This conference brings all three of those goals together. The consortium was established in May of 2019 at the end of the first conference, which was in person. We wish we could, of course, have an in-person conference again at this point. We look forward to the possibility of that in the future. The consortium has conducted several activities in the past few years, including assisting departments with preparedness for site surveys from healthcare regulators. These conferences, of course, are one of the main outputs. This is the third in the past 3 years. And we have a website, the NAEMC.org, which we invite everybody to have a look at, where we share resources for those leading emergency departments, working in emergency departments, as well as upcoming events. We also have a Slack community, so if you're interested in that, you can drop your interest in the Q&A or reach out to our website administrator, Chris Will, through naemc.org. So we invite everybody to have a look at the website. A quick rundown of the agenda for the next 2 days. We're starting off, of course, with introductions as well. I still see Ken muted, so Ken, feel free to interrupt and jump in anytime you want. Then we're going to move on to a panel discussion. We've got a robust lineup for the panel today that is going to be the main focus and one of the main discussions around COVID. We promise that in the next 2 days, you're going to hear about a lot of content not related to COVID, because we continue to have emergency conditions that are non-COVID related that we have to take care of. And one of our goals for this conference was to bring you some non-COVID content. But we're going to start with a discussion of operational changes that several departments in the IHS system underwent and how it will affect the operations of their EDs moving forward. So we're going to hear about not just lessons learned, but lessons and experience that will, for the foreseeable future, change how operations are conducted in emergency departments within the IHS. Then we're going to hear from our keynote speaker, Dr. Mark Rosenberg, who's the president of the American College of Emergency Physicians. Dr. Rosenberg was kind enough to lend us some of his time, and as you can see, we had to put him in the middle of the lineup because there are many demands, as you can imagine, on his schedule. So we look forward to the keynote by Dr. Mark Rosenberg. We're going to hear about an update on COVID-19 transmission and risk to healthcare workers, which of course has been an ongoing challenge throughout the pandemic, followed by a discussion of digital health innovations for low tech communities, and closing out today with a discussion of moral injury and impact on wellness to emergency medicine healthcare providers during the COVID-19 pandemic. So that's day one. Hey, good morning, Ken. How are you? Ken's looking good. And he said he was going to get a cup of coffee. That definitely seems like he got that.
I actually got 2, and now I'm fresh as a daisy.
Ken, thanks again for joining us after your night shift. That's pretty heroic, and glad to see you're well supported with sponsors there. You're looking good.
I do feel like NASCAR this morning.
Moving on to day 2, again, starting at 8 a.m. Pacific time. We're going to hear from our colleagues who are in the background right now. They're keeping this program running. Those folks, specifically, we're going to hear from Dr. Valerie Dobias and Dr. Andrew Ayer from Brigham and Women's Hospital, who also represent the Frontline Indigenous Partnership. They're going to provide a program overview for everyone for their work in the past and moving forward. Then a very interesting discussion, a case of cryoamputation in the setting of sepsis. So this is going to be a discussion relevant to all those folks on the who are presented or present during the conference who practice in low resource and remote settings. I think everyone will have some shared experience in what we hear from Dr. Eric Wortman. Then on to a little more COVID content with critical care and extended critical care in the emergency department. As everyone knows who works in a remote setting, those of us in emergency departments, we're not just focused on necessarily the first hour of care, but up to the first 12 hours of care in cases. So we're going to hear from Dr. Raghu Sithala on that. Followed by a small panel, 2 national experts on ED interventions in opiate and alcohol use disorder, followed by a discussion led by Dr. Chelsea White around EMS adaptations and innovations during the pandemic. And then getting into some remote practice specific content, a discussion about transferring, getting your patient disposed and placed as efficiently and effectively as possible. Followed by that, we're getting into an airway management discussion in the era of COVID. We've been through so many iterations of what it means to place a safe airway. We remember we had those boxes for a while, the kind of saran wrapped and plexiglass covered boxes. So we're going to hear a bit about that and close the conference with a video from Z-Dog MD, which I think everybody is going to find very fulfilling and hopefully put some wind in your sails as we close out this year's conference. Ken, did I leave anything out? Anything to add
No,
about
you didn't leave anything out. Just a note on the format is that, we are trying different things as we're moving into this virtual world, and you may know that the sessions will be a bit more condensed and a bit more rapid fire. You guys are already heroic for sticking with us for 4 hours on 2 consecutive days in a virtual meeting, so thank you. And we also wanted to just press our speakers a little bit more too, to get down to the nitty gritty, the most germane and the key pearls that we need to know for each one of their expert topics. So again, if you guys have any feedback, please feel free to share that on the chat about any particular talk, but also any evaluations following up, and Sean will talk about that coming up next in the housekeeping.
Thanks, Ken. Some quick housekeeping. So at this point, I think everyone is at least has a cursory familiarity with Zoom. That's the platform we're using for the conference. Ask folks to please keep their lines muted, though we are using the webinar format. So our team in the background has a fair bit of control over things like that. The session is recorded, and your attendance basically is consent to be recorded. So any content shared in the Q&A, please be mindful that this is going to be a recorded session. It will be posted for view following the session. So just please keep that in mind as we foster discussions throughout the conference. We're using as I said, the webinar format of Zoom, which relies on a Q&A feature, which if you see at the bottom of your screen, there's a Q&A icon to click on. Please bring many questions and comments throughout the presentations. We would really like to cultivate an environment where we have discussion as robust as possible, given the limitations of a virtual format. So please drop Q&As throughout the discussions, throughout the presentations as you have them. Panelists will do their best to respond to those in real time. And if we can't respond to them in real time, we'll try to bring them up when there's time towards the end of the sessions for discussion. So please use that Q&A feature. There will be CME available in the chat feature, and unless someone from Flip wants to correct me on this, is where we're going to share the link for the CME. It's going to be shared at the end of each session. We know not everybody can make it to the full 4 hours. So there will be a link for a post-session evaluation. Like with other conferences, you complete the evaluation, and then you'll be eligible for the CME for the sessions that you attended. And again, those are going to be at the end of each presentation. So please keep an eye out. If you can only make 2 sessions, please keep an eye out for that link and feel free to click on that. And look, we're in Zoom. Our first panel has folks coming in from 3 different states representing about 5 different facilities. We are fully ready for technical errors. We just hope that when we freeze, we don't freeze in some compromising or awful facial contortion, but please bear with us. So we ask for your kindness in advance as we work through any technical hiccups that we experience. We do have some redundancy for emceeing, keeping the program moving forward in the event that we do experience technical issues. But we're ready for the kids, the pets, the spouses and roommates who walk by. We're ready for all that. So we just ask for your cooperation and patience with us as we work through that.